Yes, good afternoon, everybody, and sorry for the slight delay to the webinar. So the idea of this webinar, so it's hosted by the INFORMAS network. So INFORMAS is the International Network for Food and Obesity and CD's research, monitoring and action support. And over the period 2021-2024, a specific project was conducted, funded by IDRC, which was looking to update the INFORMAS modules to also integrate environmental sustainability. So there was work going on in Africa, Latin America, to work on the cost of diets, but also to look at government and private sector actions. So the Food EPI tool, which was developed in 2013, was one of the main tools of INFORMAS, but heavily focused on improving food environments for obesity and CD reduction. But the IRC project took it a bit more towards food systems, has been developed as part of the project. So that is the key topic of today's webinar. So to dive in a little bit on how this new index was developed, and then hear a bit from West and East African partners on how they have adapted it and implemented it in their context. So to hear a bit on lessons learned as well. And then we'll still have a presentation also on the business impact assessment that was done in Senegal as part of the project as well. So that being said, we can start actually with the first presenter. So I propose that we have the presenters, and then we can take like one or two questions, move on to the next, and then we still have time at the end of the seminar to, of course, have a broader discussion as well. So that being said, I would like to introduce the first speaker, which is Celia Burgas. So Celia is a postdoctoral scientist, and she did her PhD actually on this INFORMAS 2.0 project on really developing the new index, and then also working with the African partners to adapt and implement it. She's currently working at the European Commission, so she started a new job already there after her PhD, also on sustainable food systems, among other things. So Celia, if you're there, I'm happy for you to take the floor and to tell us a bit more about the Food Systems Policy Index.
Sure. Thank you, Stephanie, for that introduction. I hope you can hear me, and I don't know if you can see me because my camera doesn't seem to be working, but I'm sick, so I don't know if I want you to see me because, yeah, it's a very bad week. I'm sick, home with the flu. So, well, you're not missing much if you cannot see me. I'm going to share my screen. You should be able now to see my presentation.
Yes.
Okay, perfect. Yes. So indeed, as Stephanie said, I was working doing my PhD at Cienzano in Belgium, and it was part of the INFORMAS network, and I'm still part of the network, very proudly, to be honest, because it's an amazing network. We are doing a great job. And my PhD was, the goal was to try to create a global policy index to stimulate governments and propose different policies and try to find synergies and trade-offs towards creating sustainable food systems. So I'll tell you a little bit how I did this process. First and foremost, in the network of INFORMAS, the focus is mainly on food environments, but we also realized that it was important when talking about undernutrition and obesity and environmental sustainability to focus on the food system as a whole. which of course includes food environments, and is this complex web of activities from basically from farm to fork and beyond. Um, that defines, of course, the food that ends up in our plate and how we interact with food and the impact that food has in our health and in the health of the planet. So these are the reason why the research started was already in 2019 when two very big publications were published in the Lancet. One was the global syndemic of obesity, undernutrition, and climate change that you can see here. And the other one was the first Eat Lancet Commission, that the second one has been published, as you of course know, a couple of weeks ago. And it was agreed that the change in our diets and in our dietary patterns is one of the most powerful ways that we have actually to mitigate climate change and to address obesity and undernutrition. And in my research, I focus on governments, which is one of the main actors of the food system. Of course, governments are a very, very complex actor and is not a singular one. It depends. A government on its own is a multi-actor, depending on the type of party that is in power, on the type of jurisdiction, the type of power that it has. But well, we wanted to really focus on the public sector. But there are, of course, other powerful actors in the food system, like the private industry and NGOs, and other part of the work done by INFORMAS is also on the private sector to see which actions they can implement. But well, my research and what I'm explaining today, it's related to governments, because they are, of course, as I said, very powerful. And the goal is to create this policy index. I took inspiration from the Food EPI, which was honestly a great tool, and it's great and benchmarking and analyzing and monitoring also what governments are doing. So the goal was to create a similar index with different indicators or good practice statements for governments, so that they could create healthier, more equitable, and sustainable food systems. This was very challenging and also very ambitious. So it was done in 5 steps. The first one was a compilation of recommendations that I'll show you now. It may be a little bit outdated because this was done in 2021 and it was different compilations published until then. And now, well, the good news is that, of course, there is even more evidence available, but well, it's still interesting to see how the methodology was done and what the results were. Then the second step was the scoping review that it's already published, and I will talk a little bit about that too, and you can read it later. Then we did an expert consultation. In theory, it was going to be a Delphi study, but then we realized that there was a lot of potential to actually consult different experts. So we decided to do it like that instead. Then we had a policy mapping that was done in collaboration with our African partners that are also part of this webinar, and stakeholder interviews. That is the same. This was also done with our African partners. They are going to also talk about that, and I will just show you some general results. So while the compilation of recommendations started, as I said, we started it in 2020, 2021. So some of them are a little bit outdated and they have created new versions, but still it's interesting. Some are annual, so you can have a look at them. But we really gather a lot of recommendations for governments. And the nice thing is that now that I continue to read new ones that keep coming either at national, European, or global level, the recommendations stay quite similar. Now there is more focus on commercial determinants of health, and of course acute food insecurity because of war, but in general it's really similar to the type of recommendations that we already collected during this first phase. This help us to actually define which were the domains and the subdomains that we're going to be focusing on. And I say this word, which I know is tricky if you are not familiar with the Food EPI, but in the Food EPI, they had divided the tool in different domains. And actually, those are these ones that you can see here. So food composition, food labeling, food promotion. So those related to the food environment that are the last 6 ones were actually taken, actually even 7, because food trade and investment agreement was also part of the Food EPI, were already based on the Food EPI. And then we introduced the first 3 ones that you can see in this slide that are related to more the supply chain and agriculture and fisheries, so the initial part of the food system. So we classified all of the recommendations that we gathered, and we merged them into similar ones to try to understand different actions that can be undertaken. And of course, because it's about food security, obesity, and environmental sustainability, there were a lot of recommendations in the section of agriculture and fisheries, but that's normal. And just to give you an idea, based on this exercise, we could then propose policies like this one that you can see here. For instance, in the section of food production and agriculture, interventions or good practice statements to see if the government is actually doing something to tackle the use of fertilizers, of course, synthetic fertilizers. Another one that is related to the food environment is this one of marketing, to see if the government has restrictions of marketing of unhealthy or unsustainable foods. And another example, even if I know there is a lot of text and it's not so easy to read, is this one for the food retail for zoning laws. No worries if you want to read it all, because at the end of the slides, I'm going to show a QR code where you can also have a look at all of this in detail and specific to the areas you're interested in. But just to give you an idea, we gathered 44 proposed policies. Then the second step, as I said before, was a scoping review that is already published. And in this paper, we wanted to see which are the effects and the effectiveness of different food policies that have been reported by different scientific articles. And this was quite a big we gathered a lot. It was a lot of work. We gathered quite some articles, almost 200, which was very interesting. And then it was, of course, summarized in a narrative way, in which we decided to show if the effect of the policy was positive to each of the outcomes, neutral, so that there was really no effect after the policy had been implemented, negative, which of course means that it had a policy was implemented and it had a negative effect on the outcomes. And then because there were so many papers, we also had some that we couldn't really understand if it was going in one direction or the other, because the number of papers were very similar and also their quality, and some were pointing into one direction and others in the other one, so I was not sure. And then we also had data gaps, because of course some papers didn't focus specifically on this type of things that we were seeing. So, sorry. Here are the results. I know it's quite a complex table with colors that I'm not sure if that helps or not. But well, you can see the direction of some of the policies and the effects that it has on the three, well, on the primary outcomes that we were looking at, which are, as I said all of the time, undernutrition, obesity, and environmental sustainability. And you can already see by this scoping review, which was one of the nice key findings, is that you can see some policies that have triple duty potential. So that's really good. That can really, one type of policy in one specific area can be good for the three outcomes that we were studying, and others that had double duty potential, which are mainly related to the food environment. However, there were also some gaps, as you can see. So we realized that that was going to be quite challenging, because we didn't have information on specific policies, for instance, for marketing or for food composition or reformulation or food loss and waste, and the impact that it can have on undernutrition or even environmental sustainability. Whereas we can imagine that it really should have an impact, but there is not enough data. There were some negative aspects related to trade and investment agreements, and inequalities was really an indicator and an outcome that was always there, in the sense of it was not so obvious always when analyzing the effect of the policies if it was good for inequalities or not. Then because we realized that there were many data gaps, we decided to organize this expert consultation with international experts from different parts of the world that you can see here: Europe, Latin America, and East and West Africa. And we gathered all of the feedback from around 100 experts that were working in different fields. So we didn't focus only on public health or food or nutrition, but we also invited experts in the field of economics, trade and environment, and also agriculture. And we basically asked them, of the list that we were proposing of 44 policies, to assess the effect and the effectiveness that it had in all of these outcomes, and to say if they actually agreed with the identified double or triple duty potential they had. And then another step that we decided to add to this study was to rank the policies according to the level that they consider should be a priority. And well, the results of that are quite interesting because, as you can see here, we gathered their feedback. We wanted to see if there were some extra potential of the policy that we were not aware or that had not come out during the study. Acknowledging there was perceived effects of the policy and then of the evidence that we collected that is also now published in a study, so I'll show you the link as well. Something interesting was the ranking, that we realized that the fact that a policy had a triple duty or double duty potential did not necessarily mean that it was ranked as a priority. So there were some policies that maybe were very effective only in addressing environmental sustainability or obesity, but they were considered very important or even more important as a priority than other policies that could be able to tackle the three outcomes that we were identifying. So that was, I really will invite you to read that paper in detail because it's very interesting. The policy mapping and the stakeholder interviews, as they were done in collaboration with our partners in West and East Africa, I'm going to let them explain that a little bit better. But I just want to say that we collaborated with them to identify which of the 44 policies that we were proposing had been already implemented at national and at local level. So as you can see in this map, there are the 5 different countries, and then sorry, I got distracted by a voice. Let's see. Senegal and Uganda are here, so they are going to tell you more in detail how their exercise went. But something quite interesting was that the barriers identified tended to be very similar across countries. Of course, the government is such a complex actor that different factors. It can be either the main barrier or the main facilitator. And some factors are not surprising, like the lack of financial resources. But something very interesting was to see the power of consultation with interest groups and different stakeholders, and also the voice of international organizations and public opinion and awareness in order to implement different policies, which is a great result also for different NGOs working on these areas. And then a factor that is not surprising but still very determinant is the political structure of different countries. This paper has also been published, so I really, if you want more details, you can read it. I'm going to give you now the details, or you can always reach out to me. So, well, just a little scheme of everything that I just explained. These were the different steps that we undertook. And the main message from my side will be that we propose a list of 44 policies that it's out there. You can understand the effects and the effectiveness that they have, the double or triple duty potential, and then synergies and trade-offs that they can have if implemented in combination with other policies. And you could also read about different barriers and facilitators towards their development and implementation. So that's really my key message. And now that we have this list of proposed policies, now it should be the turn for advocacy and governments, and maybe also creating more research. So all of us have work to do because we need to understand some links with the effects and effectiveness of different policies and outcomes. But that doesn't mean that because there is not enough data, governments should wait, because there is a lot of data already available and things that policymakers can already do. And of course, priority should be given to those policy actions that have been already studied and that have shown to be effective, and to take into account different barriers and facilitators. These are the screenshots that I took of the 3 papers I just talked about. So this is a very important slide. And I also decided to add a QR code to a policy brief that is already published, and it summarizes in a way that it's a little bit easier and some sort of a summary. It explains all of the information that is written in the scientific paper. So I honestly find it quite useful if you don't have the time to go through all the 3 papers in detail to check the policy brief. It was even more challenging to write than the scientific papers, because explaining in an easier language the research is not always easy, but it was a really nice exercise, and I recommend all of you to do that. And I think that's it. Yes, that's my last slide. So
Great. Thanks very much, Celia, for this nice overview of the work and the Food Systems Policy Index. So I'm just looking, is there 1 or 2 questions perhaps for Celia before we go to the implementation in East and West Africa? If you want to put up your hand, for the moment I don't see hands. Perhaps a small question. Do I see a hand? No. Perhaps a small question from my side then. So we now have the Food EPI with its process that quite a lot of countries have done already, like more than 50. Of course, this index is now widening it to the entire food system. Do you think those two indices should stand alongside each other, or should we now move towards the Food Systems Policy Index? It can be also a lot for countries, perhaps, because even the food environment alone was already also quite challenging with all its dimensions and policies. But of course, perhaps countries could choose as well what their priority is and what they want to focus on, but maybe you have an idea.
That's a great question, and also a little bit tricky, because of course I'm a little bit biased, consider that I was working in the Food Systems Policy Index for such a long time. I may go more towards that direction, but honestly, I think that they should be used either together, or they should both continue to be there, because the Food EPI is extremely useful because it focuses on healthy diets and obesity, and some of the policy indicators of the Food EPI were not so prominent, or were merged, or were modified for the Food Systems Policy Index in order to make sure that there were no trade-offs with environmental sustainability or with food insecurity, which is of course extremely important. But if a government is struggling with obesity rates, I will say that Food EPI continues to be, of course, the tool to use. And in the long term, of course, will be amazing to go more towards the Food Systems Policy Index, but a starting point will be, in my case, always the Food EPI and then the Food Systems Policy Index as a more ambitious long-term plan.
Okay, thank you. In the meantime, I see a hand from Elisabetta from Brazil.
Hi, thank you, Stephanie. Sorry, I just entered when the presentation had already started, but I have a similar doubt about this. If we are applying, for example, here in Brazil, we are planning to apply for the second time the Food EPI model. And I was thinking that if we have to add these indicators to the application, or if we use what Stephanie said, we can choose some of them. Problem, we will lose one of the qualities of the INFORMAS, that is the comparability among the countries. So I think this is a problem, or not, but problem probably is a problem. And I was also thinking that when we apply Food EPI here in Brazil, we evaluated that some of the criteria for the benchmark were really different from each other. Some of them are related to experiences of very small cities, some of them for a country, and this is very difficult to actually to analyze. So I would like to know what you're thinking about that. First, if how apply this new proposal to add or to choose, and how will you deal with the conditions of comparability among the countries, and what you're thinking about the new version of the benchmark. Thank you.
Thank you. Those are very big questions indeed, because alongside this work that has been done, there are broader discussions ongoing within INFORMAS, indeed, to really also update all the modules and the Food EPI itself as well. So those benchmarks are currently also under discussion, whether it is the best approach and whether we should move more towards rating against ideal standards and using the benchmarks more as examples, for example, during the action prioritization process, because the benchmarks sometimes, and also because for some indicators, they're really good benchmarks. For other indicators, none of the country, or there is no ideal country doing the policy in an ideal way. So then the benchmarks are perhaps lower than public health people would like to see. So there are a range of kind of issues with the benchmarks. And so in the new version of the Food EPI, I think we will use them more as inspiring examples for governments during like the action prioritization workshops, and do the ratings more against ideal standards. But of course, this work is in progress because we are writing the new supplement, but we can definitely keep in touch about that. On the question about, yeah, it's true, the comparability is very important. So I think each country will also need to determine the priority of the work in terms of what you have been doing, for example, in Brazil already. Also, still focus on the food environment and then integrate some indicators on environmental sustainability within the food environment indicators and not do the entire food systems policy index. So that's also an option. Or you just stick with the original Food EPI, which is still quite fine as well. It's just that the double and triple duty actions are more and more discussed. And then the work in Africa, I'm not sure it will be explained in detail here now, but there's also been a module that has developed 11 or 12 indicators specifically on the double burden of malnutrition. So not really related to environmental sustainability, but this would be also additional. So if you integrate that, because also experts in the countries that were interested in that also didn't want to lose comparability with the original Food EPI. So then, yeah, the downside of it is that it's 12 additional indicators. It's true that I think it will come down to the country's priorities on what is the best option, to still just use the original tool, the broader tool, or integrate the double burden or environmental sustainability. So now we have these various options. So I'm not sure if the answer is fully what you expected, but it will come down to the country's priorities, I think.
No, it's great to know that we can have our priorities and there is this flexibility. Because when we apply the first round, we were really strict with the the protocol. So it's great to know that. Thank you.
Thank you very much. So I don't see any more hands, so let's move on to the next presentation. So now we are going to have a presentation still looking at this Food Systems Policy Index, but focusing on the implementation and the lessons learned from West Africa. So there were 4 or 5 countries that have contributed to this work, and the work was led by Adama Diouf from the University of Dakar, who is also online. But actually, one of her colleagues, Dr. Misturat Mama, also from the same university, who is a lecturer, researcher in nutrition at her research group on nutrition and health at the University of Dakar, will actually present the work to us. So yeah, I'd like to welcome Mistura to then take the floor, and I hope you can share your slides with us.
Yes, thank you, Stephanie. I'm trying to share it. Yes, yeah. Okay. Okay, can you see it?
Yes, thank you.
Is it on Japorama mode?
I can see the full slide, yes.
Okay, nice, thank you. Let me just close this. Yes. Okay, thank you so much, everybody. Good morning. I'm going to give an overview of the implementation of the new Food System Index policy in some Western African countries. So, West African countries are facing a triple burden of malnutrition. Significant progress have been made in combating undernutrition, but there is still growing evidence of the rising of obesity and its negative impacts on health and economy. Should be noted that food choices and eating behavior are directly shaped by food environment, which can influence socio-economic inequalities in diet and nutrition. Fortunately, food environments can be reshaped through policies and actions, targeting food entry points. However, our national actions remain insufficient to effectively improve food environment. To, let's say, help government or further of all, provide more information on policies, on how policies are implemented regarding to food environment and food system. We created a Western African network for improving food system, namely REPSAO in French, Réseau de recherche sur les politiques publiques, en lien avec les systèmes alimentaires en Afrique de l'Ouest. So its missions are to establish a priority research agenda through comparative and participatory methods to generate evidence to understand food policies and their impact on health, to share best practices in food system transformation and monitoring, and to develop a roadmap for strengthening public policies for healthy food environment. The REPSAO network was created in 2019, and in the framework of its missions, we started to assess the level of implementation of policies regarding food environments in 5 Western African countries between 2019 and 2022 using the Food EPI tools, namely Senegal, Benin, Togo, Côte d'Ivoire. I think that's it. So after that, due to the, let's say, growing demand on a tool which is similar to Food EPI, but which could reflect the implementation of policies regarding food systems, not only food environments, the Science and Law colleagues, as Celia presented earlier, develop a new food system policy index that would take into account the dual GOT, food policy, but also food climate change, integrating the sustainability aspects. So the implementation of this new policy index in West Africa was conducted during 2022 and 2023 in 5 countries of Africa. So regarding the policy mapping, the implementation, we can split it in 3 phases. So the first one was the development that Celia explained before and the validation of the new index. The second phase was the collection of evidence documents and the completion of the indicators based on that new policies. And the third phase consisted in interviewing stakeholders in the different countries and cities selected. This part was conducted in Benin, Côte d'Ivoire, Senegal, and Togo. A huge part of this, let's say, implementation process consisted in a capacity building of the country's research teams. First of all, to make sure that all the research team had the same understanding of the aim of the tool, to make sure that all the tools that would be used during the process would be well utilized. So there were a workshop after the expert workshops that Celia talked about before, a workshop for validate the index and to be sure that it could be adapted to our Western African context and that it took into account the sustainability aspects. Also, online workshop was organized in order to present the approach, to share experience, and then to present the framework of the document that was used to first, let's say, write or look for the context of the countries and the cities that would be involved and the way to complete each indicators of the policy. And then regarding the interview with stakeholders, also guiding sessions were conducted with the team of the countries in order to be on the same page on how to select stakeholders, which were the criteria, and how to use the interview guide and the protocol for interview and transcription methods. Now, regarding the implementation itself, the policy mapping was built on Food System Policy Index, domain and subdomains, capturing government policies across all implementation stages. So as I was saying, this new policy or the aim of this implementation was, yes, to capture at national level, but also at municipal, city, regional level. So each country had to select a city which would be assessed. So the selection of the city was based on either the prevalence of malnutrition or relevant agroeconomics activities. Then in Senegal, the city selected was Saint Louis, Bouaké in Côte d'Ivoire, Sokode in Togo, and Ouidah in Benin. All documents, evidence, let's say document that was included in this implementation were related with included policies, interventions, plans, strategies, and activities. And from the period of September 2022 to December 2023. Through a desk review of clear literature, policy documents, and legislation from official sources. Then, as I was saying before, Science Anno or the team, our colleagues, propose a scope document with the definitions and ensure consistency to capture all the 44 indicators, policies that are included in the index across national and local levels. And that document was the one used by all the countries to really extract data. regarding the interview, a semi-structured interviews were conducted, and the stakeholders selected were done because of their experience in food system policy development or implementation at national or local level, because we think that they would be able to give us much information as they are involved in the process. And we select stakeholders from different sectors like agriculture, trade, environment, health, and so on, to really cover a huge number of sectors. So the sampling process involved two stages. First, the country's teams compiled the list from public sources and previous projects to select the stakeholders, and a second stage consisted in following pseudo-anonymized screening by two independent researchers. At the end, 8 stakeholders were selected per country, 4 national and 4 at local level, with diverse characteristics across gender, expertise, or organization type. What did we find? What were the main findings regarding the policy mapping? We noticed that almost all policies that were documented covered the domain of food productions. Other significant priorities were found, including food storage, food provision, and food prices, but the main coverage was focused on food production. And the lowest policy coverage was related with food composition and food retail. At city level, very, very few policy were found addressing food system. And when they were existing, we could see that the coverage was related with food production. We found also that common challenges across the plans and strategies were related with nutrition and food insecurity and climate change. The results of the interview with stakeholders, which aimed at determining the barriers and the facilitators to develop sustainable food system policies, were, let's say, we tried to summarize. I think that Celia also tried to do the same. But if we could take away, let's say, some, we could say the insufficient financial resources and the lack of transparency for the barriers, the lack of political will to develop sustainable food system policies, the slowness of bureaucratic procedures for designing and implementing policies. Some difficulties arose from conflicting interests, mandates, and goals across different government ministries. And finally, an inadequate monitoring and enforcement mechanisms. Regarding the facilitators, we could cite supportive public opinion and awareness, and agenda setting steps, which means that when we define a calendar or an agenda, it is easier for government to, let's say, achieve the goals proposed. The availability of both financial resources and data, a solid political will, and an effective monitoring and evaluation mechanisms. During the implementation processes, we could face, let's say, some main constraints. It was sometimes hard to get policy documents from the stakeholders, or sometimes there were no existing documents or policies for local regional level. We could find for national level, but for the municipal, the city level, regional level, it was non-existent sometimes. Regarding now the main constraints regarding the procedure for the interview with stakeholders, we faced sometimes a refusal on the part of certain stakeholders. difficulties in making appointments due to busy schedules, some ministerial reshuffles, or political instability in some countries that really make it hard to conduct those interviews. So before I give back the floor, as conclusion, we can retain that food system policies in West Africa primarily focus on agricultural production, aiming to address food insecurity and climate change. Major policy gaps persist, particularly regarding non-obesogenic food supply chains, the reduction of synthetic inputs, and effective consumer-level food labeling or waste reduction measures. Key constraints include the insufficiency of financial resources and a pervasive lack of political will or dedicated leadership to sustain policies. These efforts are often further challenged by a scarcity of context-specific data and inadequate monitoring and enforcement mechanism across administrative levels. Successful implementation is highly dependent on strong political will and supportive public opinions. For the future perspective, the emphasis overcoming these barriers through enhanced multi-sector consultations and increasing the focus on comprehensive healthy food environments to tackle all forms of malnutrition. So I tried to summarize a bit. It was a bit hard, but thank you for your attention. And I would like to also comment that, as Celia said, all these data are in the publications of she showed before. So thank you.
Thank you very much, Ms. Turat. Are there any questions from the audience? I don't see hands. Ah, yeah, Ignacio. Oh, no, it's a clapping hand. Sorry. Okay, otherwise I propose then we move on to the next presentation, which is similar on insights and experiences of using the Food Systems Policy Index, but then in East Africa from Uganda. So we actually have with us today Madina Huloba and Pauline Nakitende from the Economic Policy Research Center in Kampala, Uganda. So I wonder, are you going to share the presentation, or is one of you going to do the presentation? So feel free to take the floor and share the presentation. You can either share it, or if one of you is presenting it, it's also fine. Thanks.
Thank you very much, Stefania. However, I'm failing to share the presentation. I don't know.
Do you see the share screen button?
Yes, I'm seeing it. Sharing is not turned on my side. That's what I mean.
Okay.
I need to send a request. I've sent a request.
Okay. Maybe, let me see, maybe the... Just checking, Boyd, are you still there to perhaps make Pauline co-host as well? Because I don't seem to be able to do it. I'll try again.
Actually, it's okay. We
I
have
see
the
that.
permission.
Yeah, Madina is co-host. I'm not sure, maybe if she can share the slides. I'm trying to look.
Trying again. No, it's still not. Let Dr. Madina try to share. Mine is not.
Yeah, because I see Martina is co-host, so she should be able to share the slides.
Actually, she's going to share on my side.
Martina, can you hear us? Or yeah. Yeah, I think it works. Yes, we can see that.
Okay, thank you so much. This side, it's good evening, good morning, wherever you are. My name is Pauline Nachtende. I'm going to present on behalf of that team, which is Madina, Loba, and Blessing Atwine, about the food system policies mapping and their experiences in Uganda. So, in Uganda, there is an increasing burden of nutrition-related NCDs in the low and medium income countries. There is an increase in NCDs, and in particular Uganda. This is largely driven by unhealthy diets and unsafe food environments. When you come to Uganda, the increasing NCD has led to increased hypertension, where we see that 11 per 1,000 people in 2016, from 11 to 19% per 1,000 in 2021. That is a big increase. Now, when you come to annual cancer cases, these are increasing rapidly, at least 32,000. Then the diabetes case is increasing, has increased from 2.2 prevalence of adults. That is an approximate of 3,609 total cases in adults. Then we also have increasing cases of obesity in the country. All these ones are evolved around the food environment and the food that people are eating in the country, which are causing all this. Next. Now, when we go to the study, we see that these fiscal policies and regulatory measures to restrict unhealthy food environment, that is unsafe food, yield substantial and cost-effective health gains. This has been evidence that is here in the country. However, the evidence needed for comprehensive actions by the government to foster food safety is still limited. Therefore, we set out to map out and identify the existing policies and regulatory measures that promote food safety, and to see the challenges and gaps in the policy and regulatory environment. What were the objectives? So when we look at the INFORMAS 2 domains and indicators, we see that there were different indicators in the food supply chain and the food environment. As Celia has mentioned, these are the categories. And when you look at the INFORMAS 1, there are some indicators that were increased in the INFORMAS 2. They were in the INFORMAS 1, but they weren't. In the INFORMAS 1, they were not there, but in the INFORMAS 2, there was an increase. For example, the Food and Trade Investment Agreement. Yes. Next slide. Next slide. Hello. Okay. When you look at, we looked at these domains and indicators, that is food production, food storage, processing, packaging, food loss and waste, then trade and investment agreements. Now, what were the objectives? For the Food EPI 1, we defined that there was a definition of the priority food system policies that was done for all the countries that were to do this, that were supposed to do this work. So after defining the priority food systems and policies, we embarked on mapping of the policies. This was done by desk review in order to pilot them, test them for the public sector in a range of the national and the municipality jurisdiction in the country. So after, we had also the objective of the barriers and facilitators of the policies, that is implementation and adaptation of the newly proposed index. This index and practice policy domains and indicators in the selected cities and the national levels. These were the three objectives that we mainly looked at. Next. What was the study focus and rationale? When you look at what we decided to do, we wanted to map out Uganda's food system policies and capture the experiences at the national and local level using the INFORMAS 2 framework. Then we realized Uganda has numerous food-related policies, but no harmonized indicator framework to measure progress. So this INFORMAS 2 came in handy to help us map and measure all those indicators. Then we also focused on understanding how policies are interpreted, coordinated, and practiced rather than only what is written. Because we find that there are very many policies that are written, but then the practice, the coordination of the different government institutions and the private was rather not clear enough. Next slide. What methodology did we use? We carried out a desk review of the different laws, strategies, and plans related to the different domains, as this has been indicated in the previous slide. We carried out key informant interviews with policymakers, local officials, civil society organizations, academia and private sector actors. Then we also looked at areas of Kampala representing the national policy institutions and Bale City representing the implementation realities of the local government. When you look at this map on your right, you will see Kampala as indicated in red, which is the capital city of the country, and in Bale. Bale is one of the cities. All these others are cities: Arua, Guru, Pakwach, Lira, Masindi. However, we chose Mbale, given that Mbale, when you look at Mbale, it's nearer to Kenya, and there is a lot of trade that goes on in that city, which will help us. We looked at the component of the food trade and investment agreement that helps us to see the trade. We looked at that aspect to choose Mbale other than the other cities in the country. Next. So while we're mapping, we reviewed over 40 policy and legal instruments. Celia mentioned that we looked at 61 in particular. These are very many. So we categorized them under the food supply chain and the food environment domains. So what did we look? What legislations did we look at? We looked at the policies and laws. We looked at the strategies. We looked at the plans, the guidelines, intentions, and funding. And we mapped them according to each and every indicator that was indicated in the Food EPI. That's how we came up with the 61. Then when we go to the insights from Kampala City interviews, we realized that policymakers are aware of the national nutrition priorities and global commitments. However, they face a challenge of enforcement. Enforcement mechanisms are weak and data systems are fragmented. In other words, data is everywhere. So bringing it together and harmonizing it is a challenge. The private sector plays a growing role in food processing and retail, but lacks incentives to prioritize sustainability and nutrition labeling. Nutrition labeling is currently a challenge, and also sustainability of some of these some of these policies or some of these actions, implementation actions that are in place, some of them are being categorized by politicizing, which prevents them from being implemented really in the country. Then when we look at stakeholders, also stress the need for cross-sector platforms and stronger regulatory oversights. You would realize that some of them looked at a particular sector, say agriculture, say manufacturing, depending. However, if at all you harmonize and you see how the different sectors are interrelated, that would be, and regulating them in that way, that would be more effective. Now, we also have one respondent who said that we have excellent policies in Uganda. However, there is limited implementation. There is that challenge of implementation. Policies excellent, but the implementation. Then when we go to insights from Bali, the secondary city that we looked at, district leaders, when we talk to the district leaders, they highlighted funding constraints and limited capacity to implement national policies. They saw money that comes to the districts, it's very limited and it has a lot of things to do. And also the implementation capacity. Some people are not, they don't have the knowledge on what they are doing. You know, some realize that some just come and learn on job, yet they do not have that prior experience. So that limits the implementation. Then there is a lot of informal food markets that dominate Mbale City. There is a lot of food loss and poor handling. So this has limited the, you know, being able to take this food to other areas. In other words, it just gets spoiled from the markets because these are not regulated. The transport to also transport this food from Mbale to other areas is also limited. So that brings a challenge. When we come to nutrition programs, these are often designed without reflecting local diets or preferences. Now, for example, these programs are done in Kampala and then they are implemented in Bali. Remember, when you do that, there is no local ownership of these programs because what is in Kampala is different from what is in Mbale. So there is that mismatch of just putting policies and in the different cities without looking at the local context. However, the civil society organizations and community groups have been active in promoting the school feeding and food waste reduction initiatives. You see, they are trying to do what it takes to make sure schools have food and also food wastage is reduced by bringing in, say, an informer told us when it comes to meat, they are bringing in those fridges that can enable the food go for a longer time. Then the Mbale findings reveal a major gap between the national ambition and the local feasibility. What is at the national vis-a-vis what is at the municipality, there is a big gap, a major gap, whereby there is need for harmonization. Next slide. Next slide. Overall lessons from the field. We find that food systems are understood differently by policymakers and implementers. The people at the local and at the municipality and the people are in Kampala understand these food systems differently. Then the bottom-up engagement, whereas the bottom-up coming from consultations from the people on ground to the government strengthens policy relevance and community ownership. Then also stakeholders desire a single coordination mechanism for food systems. There should be a mechanism that connects all the cities, all the districts of the country to one one mechanism that is in the country. Then the local governments are willing to act but need data capacity, and funding. They told us these local governments, they have the will, but the environment in which they operate, when it comes to data, they don't have that the capacity. If at all this can be strengthened, then this can be worked on better. Then we also realize that mapping policies alone is not enough. However, we need to understand how implementation provides the missing piece for systems transformation. In other words, we have to, after mapping the policies, we have to see how they are implemented also in other areas, so as to see the gap and mismatch and where government should come in to close. In conclusion, policy mapping and stakeholder interviews provided a realistic picture of Uganda's food system governance. We got to see the policies, the laws, the bylaws, the ordinances, that is at the national and the city level. Then the policy also highlighted the need for coordinated, well-funded, and evidence-based policies up to the local government level. In other words, you have to customize this also customize the policies into the bylaws, ordinances at municipalities, secondary cities, and districts. This process has to be well coordinated at each and every level. It has to start from down, then it goes to the upper, that is the overall government. Then the third one, a sustainable and healthy food system is achievable through collective accountability. That is of the government, of the civil society, of the individuals themselves. In other words, everyone has to be accountable for this sustainable and healthy food system. Thank you so much. Wow.
Great, thank you so much, Pauline and Madina as well for this nice overview of the implementation in Uganda. Is there a question? Someone has a question? I'm also keeping an eye on time a little bit, so we have 15 minutes. Any question? Otherwise, I want to say, of course, this work has focused uniquely on the African context. So we haven't, or there haven't been any work on this food systems policy index apart from in the development, but not in the implementation in any other continent. So it would be nice to also see what the experiences there would be. Also, the local level is, of course, still a level more complicated because, of course, the jurisdiction is quite different from national government. Like, not all indicators are relevant at that level, and one city and one country is, of course, not the same as a city in another country. So the contexts are different, jurisdictions are different. So a lot still to learn in applying some of these tools also at the local level. So the African partners have done some work on this, but there would be also, it would be nice to extend it to other cities, municipalities, and see how such a policy index can also help the efforts on food systems at a local level. But it's complicated as well in some ways. So, okay, I don't see any hands. So then we will move on to the last presentation of today. The last presentation is a bit different, but it still fits with the seminar in a sense that, of course, we have governments, but then there's industry as the other actor. And most of the work on the private sector module of INFORMAS has been done so far in high-income countries, where there's also an index. It's not an index, it's called the Business Impact Assessment on Obesity, and an extension on environmental sustainability, where commitments of companies are gathered and scored, and then dependent on data availability, also practices are evaluated. And then there is kind of a ranking of companies at the country level in relation to their, commitments and practices on food environments. And so Senegal is the first country who implemented or who tried to implement this tool in lower income context. And so it's indeed a bit more challenging, and the process is a bit different as well. So for that, I think it's also important to kind of cover this experience in this seminar. And so we have with us also from the team of Adama Diouf, we have with us Dr. Mane Helene Faye, who is a lecturer researcher in food and human nutrition, also at the Laboratoire de Recherche en Nutrition et Alimentation Humaine from the University of Dakar. So Mane, you have the floor.
Thank you, Stephanie. Are you getting my screen?
Yes, but it's not full presentation mode yet. So okay. Yeah.
Okay, thank you for giving me the floor to share our journey with the BIA obesity in Senegal to evaluate company commitments on population nutrition. Sorry. We will follow this outline. An introduction, we know how unhealthy food environments can impact our diets to make them unhealthy, with a domination today with ultra-processed food in our food environments that are higher in nutrient of concern, accessible but also affordable, and subject to heavy marketing. And consequently, we are facing higher levels of overweight, obesities, and NCDs, with pressure on healthcare, loss of productivity, poverty, but also death. And we are also facing a global burden with no age spared, with low and middle income countries affected by this situation, but also an economic toll which is significant. In Senegal, we are facing a triple burden of malnutrition because while we are still fighting against undernutrition and micronutrient deficiencies, we observe emergency and increase in overweight, but also in obesity and non-communicable disease prevalences and their risk factors. And those account today for 53% of deaths attributable to NCDs in our country. In addition, recent evidence show that products that are present in supermarkets are 70% UPFs, and that those products contribute to the intake of nutrient of concern, meaning sugar for 43%, 27% for total fat, and 24% for sodium intakes in Senegalese adults. And we also see that 21% of the food present in supermarkets have inappropriate labeling, and that 87% of food marketed in TV and around school are unhealthy. Today, we know that creating healthier food environment should require bold action from the governments, as we already say since the start of this webinar, but also we need large and responsible action of the food industry. We also need community support, but we need also that research bring evidence to support decision-making, to strengthen policies, but also actions for healthy, equitable, and sustainable diets. Many actions have been identified for the food industry to contribute to healthier food environment, including limiting the content of nutrient of concern in the portfolios, reducing portion size and energy density, practicing responsible marketing, but also providing nutrition labeling in line with international standards and offer healthy and affordable food choices. However, we have limited evidence on how the private sector is contributing to healthier environments, especially in low and middle income countries. So this conducts us to implement the business impact assessment developed by the INFORMAS. The BIA obesity is a tool and a process that help us to assess policies and commitments of industry towards nutrition and health of the population. It can help increase accountability and action of the food industry. It helps highlight leadership areas where industry is doing well, but also to identify best practices and to set recommendations for them to follow to improve food environments. This process has been widely implemented in several countries, but it is the first time it is implemented in settings like ours. The objective of our work was thus to assess policies and commitment of major food companies toward population nutrition and prevention of obesity and NCDs. For the methods, we followed the standard BIA obesity process, starting with selection of the major food companies, collecting preliminary data, but also establishing contact with company representative, and then assessing companies using the tool, the BIA obesity evaluation criteria, and formulating priority recommendations for each company. These steps have been completed, and now we are in progress to provide each company with the result of the assessment and publish the results. The selection of food companies for the BIA obesity is based on the significant influence on food environments and potential to improve diet. Usually, we base on market share data, but at the time we started this work, there was no data available for Senegal in global market database. So we used a two approach. The first one to identify food and non-alcoholic beverages manufacturers was a market survey that we implemented in 2021. And for supermarkets and quick service restaurants, we were based on brand awareness, but also the number of point of sales. And finally, it helps us to identify 37 food companies, including 25 food and beverage manufacturers, 5 supermarkets, and 7 quick service restaurants with an integration of both local and transnational companies. For the data collection, we collected publicly available data on companies' websites, annual financial reports, and also press releases. And for complementary data, we contacted the company's representatives, sending them letters with the project presentation, but none of the company responded. So the result we are presenting today is only based on publicly available data. For the assessment of companies, we organized a workshop inviting some experts in the different domain of the BIA obesity. And we then continue working at the laboratory with the project team, Prof. Adama, Mireille, and one master which worked on this project. For the assessment, we used criteria of transparency, comprehensiveness, specificity, but also relevance to the national context through the different domain of the BIA obesity. I mean strategy, corporate strategy, product formulation, labeling, promotion, accessibility, but also relation with other organizations. And based on their performance in each domain, the scores were weighted, and we attribute to them overall score from 0 to 100%. After this assessment, we organized a second workshop in this year, in 2025, to really propose key recommendations for each company, but also by sectors. What did we find? We find that overall, food and beverage companies, supermarkets, and all the sectors, when putting them together, have had a low performance at only 14.2%. When we go within the sectors, we see that food and beverage manufacturers and supermarkets were better than quick service restaurants. We also see that in all the sectors, local companies were outperformed by transnational companies. And when we go to the performance of companies within the BIA obesity domains, we observed that they were best performing in corporate strategy, but promotion of product and brands was the least performing domain. And then when we go within specifically in the sectors, corporate strategy remains the best in food and beverage manufacturers, formulation for supermarkets, but for both, we see that promotion of product and brand and accessibility for supermarkets was the worst performers. And for quick service restaurant, we had median score for all domain at 0. Now, the result for each domain, we have for corporate strategy, we found out that 48% of the companies had commitment to nutrition and health. However, only 7 out of 21 reported against nutrition, health objective and targets. And when it comes to report on objective, specifically for Senegal, only 3 companies out of 25 had commitments that covered the country, but they were not specific mention of our country name. And then when it comes to the supermarkets, we only have 3 out of 5 companies with commitments. Their commitments include a specific target for obesity and NCDs, but only 1 in 5 have commitments that were comprehensive in nature. It means commitments in at least 3 domains of the BIA obesity. And for quick service restaurant, we found out that only 2 companies had commitments, but their commitment was not specific to obesity and NCDs. For product formulation, we have 17 companies with commitments to reduce nutrient of concern, but we see that beverage manufacturers did not have commitments to reduce salt or sodium, specifically sodium in their products, and they did not also have commitment to align with the position of government policy on formulation. Only 1 company had commitment to reduce added sugar, to adhere to voluntary initiative of reformulation, and to align with the position of the World Health Organization on the formulation. And for packaged food manufacturers, they were better in commitment to reduce salt and sodium and added sugar, and were least performing in reduction of portion size and trans fat in their products. And for supermarket and quick service restaurant, we have the same scheme with really low commitments to improve products formulation. Only 1 quick service restaurant had commitments, and it was mainly commitments to adhere to industry initiative in product formulation, and also improvement in the quality of frying oils. In the domain of labeling, only 1 packaged food company had policies to mention the presence of trans fat. Only 1 in beverage manufacturers and 1 in 3 in packaged food had commitment to display information on added sugar. And we see that in approximately all the indicators of this domain, beverage manufacturers did not have commitments, while for packaged food we have commitment to disclose composition information on request for 50%, and only 10% were engaged to align with the World Health Organization position. And for supermarket, we see that none of them have commitments to reduce health claims on products. Only 1 committed to to disclose nutritional information online. And for quick service restaurant, we have the same company with a commitment to product labeling with nutritional information on the website and in-store both and the use of the Nutri-Score. For product and brand promotion, only food and beverage manufacturers had commitments, but the median score was 0. So what we found is policies and commitments was solely, uniquely focused on children under the age of 12 and did not include all the adolescents. And we found only 36% and around 30% with commitment to reduce marketing in broadcast and not broadcast media, respectively. And when it comes to marketing techniques that appeal to children and adolescents, the percentage of companies with commitment was very low. The maximum was 36% that have commitments to market unhealthy foods brands in child-friendly environments. For accessibility, no company publicly disclosed its position on tax policy. We have 9 in 25 companies who have commitment to comparability of prices between healthy versus unhealthy foods. 60% have commitment to increase the number of the number and proportion of healthy products in the company portfolio. However, when it comes to the reduction in the availability of unhealthy products, we only have 8% of commitments. And for relationship for as organization, the best commitment is disclosure of philanthropic funding, and the worst was disclosure on political donation for food and beverage manufacturers. And for supermarkets, details on external research was really low. None of the companies disclose it. And for quick service restaurant, only 1 in 5 committed to publish information on philanthropic funding. So for the key recommendations following the workshop, I will not read all the recommendation. I will just give one per domain in the different sectors. So for corporate strategy, the main was to define objectives and KPIs for nutrition and health policies and to align company strategy with national and WHO policies on obesity and NCD prevention, to set recommendation and smart objectives for developing new products and reformulating existing products for the reduction of nutrient of concern, energy content, but also portion size, and for relationship with other organizations to disclose all involvement and support to external groups. For food and beverage manufacturers specifically, it was recommended to display full nutritional information, including nutrient of concern and health claims, to provide ingredient and nutrition facts on the front of the package, but also in product and brand promotion to adopt policies to responsible marketing practices aligned with national or WHO guidelines. And for product accessibility, for example, we had a recommendation to increase the share of healthy products, but also to disclose company position on relevant tax policies. For supermarket, nutrition labeling related recommendation was to display nutritional information clearly as it is done for prices, for example, on shelves, but also to increase the proportion of healthy products displayed or advertised in store and on marketing materials. And for product accessibility, for example, to improve accessibility and of healthy products and to offer promotional deals exclusively only on healthy options. And finally, for quick service restaurant, to display product nutritional information on in-store boards, for example, to include ingredients and nutritional composition, for example, in communication materials. For product and brand promotion, to restrict advertising of unhealthy food and to adopt policies, and for product accessibility to offer affordable, balanced menu that promote healthy choices, but also to restrict location of unhealthy product sales near school and hospitals. In conclusion, we found that food company policies and commitment remain limited in promoting population nutrition and preventing obesity and NCDs in Senegal, with most of the policies not tailored for the national context. We identified critical gaps, especially in 3 domains: product and brand promotion, nutrition labeling, but also product accessibility, with performance disparities between sectors and company origins, transnational compared to local companies, and even transnational companies perform poorly in the weakest domains. Food companies today, we think, must strengthen their commitments, but also our government should take a clear political stance and establish strong policies to ensure corporate accountability. Thank you.
Thank you very much, Mane, for this overview and this challenging exercise in the Senegalese context. I realize we are already a bit over time, but does anyone want to have a question for Mane on this? I do have one, because the commitments, I mean, I think it's a good starting point because, I mean, we want companies to be more transparent and to make their commitments more specific and smart, as we call it. But on the other hand, commitments are also just commitments. And I know that in Senegal, you have done a lot of work as well on gathering data related to marketing to children and also doing a first study on the nutritional quality of products in supermarkets. So I think, I mean, of course, if it's feasible and if time allows it, but it could be nice to sort of use that to look into some of the practices, like look at how healthy the portfolios are of the biggest packaged food and drink manufacturers and to what extent or which foods they market to children across media platforms, because then you also have some data on the practices. I did see that some of the scores for reformulation, the commitments were quite high, actually higher than we have in some of our countries here in Europe. So is that something you would be interested in doing, even if there's, maybe perhaps more time and funding needed to do it, but it would be nice since you have some good data to do some of the practices as well.
Thank you, Stephanie, for your question. I think you are right. We have really gathered an important, let us say, an important mass of information on food environments. And I think if time and funding is available, I think it is something that we can do, because when we started on this, it was really phase 1 of BIA obesity to evaluate commitments. But as we started and continued, we have additional information to really compare commitments with practices. And I think this is important, and sure we will do this soon, very soon. As I mentioned, we are working to finalize the company scorecards, but also the report and the paper. And I think at this time we will see how to integrate and evaluate the practices. Maybe Adama, which is present in this call, can give additional insights.
Thank you.
Thank you very much.
Thank you. Thank you, Stephanie. Thank you to Sciences ANO and INFORMAS for this collaborative research with Allo Senegal based on this finding in the implementation of BE obesity, but also of the marketing of unhealthy food. Now Senegal is in the dynamic to produce a nutrient profile modeling to support the development of to support the restriction of marketing. So to say that it is really important to gather all this evidence, and yes, if you have additional support, financial support, we can go forward to provide more evidence. But what is really important is that the finding of from this BE obesity implementation as well as the marketing of unhealthy allows Senegal to really develop the policy aiming at regulating the marketing of unhealthy food developed by the industry. So it is my comment on this webinar, and thank you all for providing all this evidence in more policy mapping. Also, we will go to share more these results in the African region, West African region, to involve all the stakeholders on this dynamic to try to see what we can display all these barriers that give this barrier on the implementation of policy related to food system. Thank you very well. Over.
Thank you. So anyone has any other question for Mane or any of the other speakers at this point? Sorry that we are over time already. Some people already left. But still, if you have a burning question, it's welcome. Otherwise, of course, we would like to thank you for your attention on this. I would also like to highlight that the INFORMAS framework is currently undergoing a revision and update as part of the INFORMAS Decade 2. So all of the modules are being reviewed at the moment to see where updates are needed. And this is also going to then be announced by Boyd and the leading team, and there will be a supplement on that as well. For any other questions or remarks, or if you're interested in any of these tools, of course, feel free to contact us. We will also share the presentations with the webinar participants. So yeah, feel free to get in touch if you want to add anything or have any doubts or want to use some of these tools. And of course, thank you for attending the webinar. There is